Hello everyone, this is Dr. Sakamoto. Today, I would like to talk about regenerative medicine for cervical disc herniation, lumbar disc herniation, cervical spondylotic myelopathy, and lumbar spinal stenosis. Now, I would like to start by talking about cervical disc herniation and cervical spondylotic myelopathy. First, regarding cervical disc herniation, as shown in this diagram, there is something like a tunnel on the backside of the cervical spine called the spinal canal. Within it, the spinal cord, which controls motor and sensory nerves from the brain, passes through. There is something called an intervertebral disc between the bones of the cervical spine, which acts like a cushion. Due to aging or stress from activities such as sports, the intervertebral disc can protrude into the spinal canal like this. And this protruding intervertebral disc compresses the spinal cord within the spinal canal. And since the spinal cord located behind the cervical vertebrae runs motor and sensory nerves to the hands and feet, here, the intervertebral disc forms and compresses the spinal cord, causing numbness in the hands or feet. And in addition to that, it has become difficult to hold chopsticks and attaching buttons has become a bit tricky. Other symptoms include a decrease in leg strength and tripping over even small steps. And another case of cervical spondylotic myelopathy. This is very similar to the symptoms of cervical disc herniation, but in terms of pathology, the spinal cord inside the spinal canal is compressed from the front, like in the case of the intervertebral disc herniation mentioned earlier. Additionally, there is something called the ligamentum flavum located on the backside of the spinal cord, and it thickens with age. As a result, the spinal canal narrows, leading to compression of the spinal cord. Furthermore, the vertebral body deforms and osteophytes form like this, which compress the nerves of the spinal cord. In other words, cervical spondylotic myelopathy refers to a condition where the spinal cord is compressed by cervical disc herniation, the ligamentum flavum, and osteophytes of the vertebral body. In short, cervical disc herniation refers to the condition where the intervertebral disc protrudes and compresses the spinal cord from the front. Cervical spondylotic myelopathy involves the intervertebral disc or osteophytes. This refers to the condition where the spinal canal is narrowed by the ligamentum flavum and other factors, resulting in compression of the spinal cord. Now, regarding the difference between lumbar disc herniation and lumbar spinal stenosis, it is actually quite similar to the difference between cervical disc herniation and cervical spondylotic myelopathy. Lumbar disc herniation occurs when the intervertebral disc protrudes and compresses the spinal cord from the front. Lumbar spinal stenosis refers to a condition where the spinal cord in the spinal canal located at the back of the lumbar vertebrae is compressed by intervertebral discs, osteophytes, and the ligamentum flavum, leading to nerve damage. The symptoms of spinal cord compression in the lumbar region include numbness in the legs, decreased muscle strength in the legs, and bladder and rectal dysfunction. A characteristic finding in lumbar spinal stenosis is intermittent claudication. This refers to a condition where, after walking a few hundred meters, the numbness in the legs becomes so severe that one has to stop and stand still. Due to conditions such as cervical disc herniation, cervical spondylotic myelopathy, lumbar disc herniation, and lumbar spinal stenosis. At first, there is slightly numbness and pain that is tolerable. If left untreated, the numbness and pain will gradually become more severe. Additionally, muscle strength may decrease, making it difficult to grasp objects with your hands or walk. From the onset of these initial symptoms such as numbness and pain, if these initial symptoms are left untreated for many years, even if surgery is performed later, there is a high probability of lasting aftereffects such as muscle strength not returning, and although numbness and pain may improve slightly, they often remain. The reason is that if the spinal cord continues to be physically compressed by the intervertebral disc, osteophytes, or ligaments, Even if nerves that have once died are released through surgery, they may not be properly repaired and may not return to normal. As a result, numbness, pain, and muscle weakness may remain as after effects. When I was working at the hospital and performing surgeries for cervical disc herniation and lumbar disc herniation, even if the patient undergoes surgery, there is no guarantee that the current pain will be completely eliminated, although it might improve slightly. Additionally, I have often explained that there is a possibility that numbness may remain. In some cases where the compression has lasted for more than 10 years, it is explained that even if surgery is performed, there is a possibility that the symptoms may not be alleviated at all. In other words, it's a surgery to prevent further deterioration. However, for those who have severe numbness or muscle weakness as after effects, we administered stem cells into the spinal cord as part of regenerative medicine, and I was honestly quite surprised to see significant recovery. Now, I would like to introduce an actual example of spinal cord regenerative medicine at our clinic. A man in his 60s. This person had symptoms of cervical disc herniation and lumbar spinal stenosis. The main symptoms are numbness in the hands and intermittent claudication in the legs. The numbness in my hand was quite severe, and when exposed to cold wind, the numbness would become much more intense. Regarding intermittent claudication, it was reported that after walking about 20 to 30 meters, the numbness in the legs was so severe that they had to stop and stand still. This person had such severe numbness in their hands that they underwent surgery for cervical disc herniation in 2002. However, the numbness in the hand did not subside, so in 2011, I underwent another surgery for cervical disc herniation. However, even after the second surgery, the numbness in the hand did not go away. Regarding lumbar spinal stenosis, 2 surgeries were performed in 2016 and 2020, which alleviated the intermittent claudication. However, the lower back pain did not go away easily, so he continued to visit the Orthopedic's outpatient clinic and monitored his condition with a weekly nerve block injection. In the midst of this, he saw our clinic on YouTube and decided to try regenerative medicine, so he came to our clinic. And here is the MRI of this person's cervical spine. This is the MRI after the surgery. The spinal canal is widely open and the large herniation has been removed, allowing the spinal cord to pass through cleanly. Even though the spinal cord appeared clear on the MRI, the numbness in the hands persisted. There are cases where numbness in the hands or muscle weakness cannot be detected even with detailed examinations like MRI. Visible protrusions of the intervertebral disc can be removed through surgery, but it is quite difficult to treat spinal cord damage that cannot be detected even with MRI or detailed examinations. And for this person, we actually administered stem cells into the spinal cord. On the 4th day after administration, the severe numbness in the hand, which could not be alleviated even after 2 surgeries, was reduced by about 30%. By the 6th day of administration, the numbness in his hands was reduced by half, and his lower back pain was also reduced by half. And 3 weeks after the administration, the lower back pain improved by 70%. And remarkably, 1 month after the administration, the numbness in his hand was reduced by 70%. And regarding the lower back pain, the pain was reduced by 80%. The numbness in the hands and lower back pain that could not be alleviated by surgery have been significantly improved through the administration of stem cells into the spinal cord. This person used to take a lot of medication regularly for numbness and pain, but with regenerative medicine, as the pain subsided significantly, they were able to reduce their medication considerably. There are spinal cord injuries that cannot be detected even with an MRI or detailed examinations. By administering stem cells to the spinal cord, it is possible to regenerate and repair damage to the fine nerves. Regenerative medicine using stem cells has a homing effect. In other words, the stem cells automatically move to the damaged areas. by administering 25 million stem cells into the spinal cord. These stem cells go to the damaged nerves and help repair and regenerate them. By doing so, this cervical disc herniation, lumbar disc herniation, and cervical spondylotic myelopathy. And with the administration of stem cells into the spinal cord for lumbar spinal stenosis, I hope it can become a new ray of hope for those suffering from aftereffects such as numbness in the hands and feet and muscle weakness. Today, I talked about the administration of stem cells to the spinal cord for cervical disc herniation, lumbar disc herniation, cervical spondylotic myelopathy, and lumbar spinal stenosis. Thank you very much.